Hi, my name is Gianna Paul, and I did my project on hearing loss and older adults. What is hearing loss? Hearing is a set of actions and reactions working together. Many parts of the ear work together to convert sound waves to understandable information that the brain can interpret as sound. There are 5 types of hearing loss. Conductive is when sound waves cannot reach the inner ear, resulting in a reduction in sound levels. Sensorineural is damage to the inner ear or auditory nerve, and therefore sound is not converted. Combined is both sensorineural and conductive, in which a hearing aid is useful for this type. Neural is a rare type of hearing loss, but happens when there is damage to the auditory nerve. This type is usually permanent. Auditory neuropathy is also rare. Sound can enter normally, but signals from the inner ear to the brain are impaired, and those with have trouble understanding speech clearly. Degrees of hearing loss. Degrees of hearing loss indicate the severity of the loss. There are 5 degrees of hearing loss. Mild means that they have difficulty hearing those who speak quietly, but can hear those who speak loudly. Moderate, vowel sounds become hard to understand, and some consonant sounds are missed. Moderately severe. Speech is inaudible without a hearing aid, though even with a hearing aid, speech is still hard to understand. Severe hearing loss is without a hearing aid or cochlear implant, speech is inaudible. Profound is the most extreme type of hearing loss, and without a hearing aid, extremely loud sounds such as airplane engines and traffic are not heard. Causes of hearing loss. Age-related hearing loss, known as presbycusis, is hearing loss that comes with getting older. Another type of hearing loss is noise-induced, which occurs from too much exposure to loud noises. Temporary tinnitus, aka ringing in the ear, after loud noise indicates that repeated exposure will cause hearing loss. Head trauma can injure any part of the ear, causing fluid leakage from the inner ear to the middle ear. Ototoxic medications, tumors, viral bacterial infections, and impacted earwax can also cause hearing loss. I'm going to be talking about presbycusis, which is bilaterally symmetrical hearing loss that comes with aging. It is characterized by an audiometric threshold shift, deterioration in speech understanding, and speech perception in noisy environments. Those aged 60 and over lose 1 decibel of hearing per year, and over 9 million elderly suffer from this type of hearing loss. In 2003, presbycusis was the second most common illness next to arthritis in aged people. Presbycusis risk factors can be divided into 4 categories: cochlear aging, environment, such as noise exposure, medications, and even socioeconomic status, your genetic predisposition, aka your sex, your race, and even your genes, and lastly, co-health morbidities. Presbycusis and cardiovascular risk factors. Some research has linked cardiovascular risk factors to hearing loss. They have concluded that age increases the risk of hearing loss, and this risk of hearing loss doubles every 5 years. Though there is no relationship between hearing loss and self-reported hypertension, but cigarette smoking can reduce cochlear blood flow. And diabetes can also impair hearing in both men and women. As it's seen, majority of these risk factors are modifiable except for age, and therefore can be targeted in the prevention of presbycusis. Presbycusis treatment. If hearing is not what it used to be, those should contact an audiologist in order to be tested. Though the biggest treatment option is the use of hearing aids, in which there are 2 common types. Analog hearing aids pick up sound waves and amplify and send them to the ear canal. On the other hand, digital hearing aids allow for programmable features such as recurring background noise and accommodating different settings. Other hearing aid options include active middle ear implants, in which a microphone and a battery are implanted under the skin, and a processor receives the signal and converts those signals to vibrations instead of frequencies. An FM system is one in which a speaker picks up by a microphone and is transmitted to the receiver. A cochlear implant is an electrical stimulation directly to the nerve, and you must have a functioning auditory nerve in order for this system to work. Study 1. A study of BMI, waist circumference, and physical activity were studied in women to determine their risk of hearing loss. This study was published in the Journal of American Medicine and ran from 1989 to 2009 and looked at over 68,000 women. BMI was calculated by height and reported biannually. Waist circumference was assessed in 1993 and then looked at again in 2005. Physical activity was first assessed in 1989 and then again in 91, 97, 01, 05, and lastly in 2009. From this study, they concluded that a higher BMI and a larger waist circumference played a role in hearing loss, though the risk of hearing loss decreased with an increase in physical activity such as walking 2 hours or more a day. The overall conclusion is that with higher levels of cardiorespiratory fitness, there is better hearing sensitivity. Study 2. A study was done to show the effects of long-term voluntary exercises on age-related hearing loss in mice. This study was published in the Journal of Neuroscience and showed that long-term voluntary wheel running distance was studied daily in mice from 6 months until 24 months. 24-month wheel runner mice had less cochlear hair cell and spinal ganglion neural loss and better auditory brainstem response compared to those mice who did not participate in wheel running. There was also a reduction in stria vascularis atrophy and a reduced loss of capillaries which transport nutrients and oxygen to the cochlea. The overall conclusion was that long-term exercise delays the progression of age-related hearing loss. Lastly, I found a study that was aimed at determining the effect of aging on amplitude detection thresholds and to investigate the effect of exercise on the threshold. This study was published in the International Journal of Pharma and Biosciences. 2 groups were studied: older adults who exercised and older adults who did not. Their thresholds were measured at 4,000 and 5,000 Hz, as well as lower frequencies such as 8, 16, 32, and 64 Hz. The results showed that temporal processing is extremely poor in older adults, though exercise had positive impact at lower frequencies such as 32, 16, and 64 Hz. The conclusion is that physical exercise improves temporal coding, and by participating in exercise, can be a protective measure against age-related defects in auditory processing. For my case study, I have an 85-year-old female who's named Debbie. Her mother and father both experienced presbycusis beginning in their 60s. Debbie was a smoker in her teens and 20s, but quit in her 30s. She currently attends her building's aerobics class every Friday from 1 to 2 and walks her dog 30 minutes each day. She currently has a BMI of 23. Her blood pressure is 120/80. Her total cholesterol is 180, LDL's at 110, and HDL's at 60. Her fasting blood glucose is 110, her HbA1c is at 6%, and her 2-hour glucose test is 140. These numbers indicate that Debbie is currently experiencing prediabetes, and if her lifestyle does not change, she may incur diabetes. Her current challenges is that she cannot hear other pedestrians or cars when she walks her dog, and she also has to sit in front of her aerobics class to properly hear and see the instructor. Debbie's goal is that she wishes to lower her blood sugar levels so that she does not need to rely on her current insulin medications, and she also wishes to negate further hearing loss so she does not put herself at risk when she walks her dog each day. Debbie is at a low risk with prediabetes and therefore does not need an exercise test to begin a moderate program. But if Debbie chooses to do vigorous exercise, then an exercise test is needed. Also, the onset of presbycusis does not indicate a need for an exercise test. If Debbie wished to participate in a vigorous exercise program, some exercise tests would be the 6-minute walk, 30-second sit to stand, timed up and go, grip strength, 1-foot balance, and a chair sit and reach. The most important thing for Debbie is that she should be referred to an audiologist to undergo audiometric testing due to her hearing loss. Currently, there is no set guideline in the FIT principle for presbycusis, and general guidelines can be followed. For Debbie, prediabetes considerations will also be followed. For aerobic activity, she should do greater than 5 days for moderate and greater than 3 for vigorous. She should participate 30 to 60 minutes for moderate and 20 to 30 for vigorous. She can engage in walking, cycling, and aquatic exercises. Debbie should also do 2 to 3 days of resistance in which she is at a moderate level, 50 to 69% of her 1 rep, or vigorous at 70 to 85%. She should do 8 to 10 exercises at 1 to 3 sets for 10 to 12 repetition. She should also combine both free weights and machines. Finally, for flexibility, she should be at 2 to 3 days, stretching to the point of slight discomfort, holding for 20 to 30 seconds with 2 to 4 sets. She should also incorporate both static and dynamic stretches. Some special considerations should be taken with Debbie, such as ensuring effective communication throughout the entire exercise session. Instructions should be presented in both writing and pictures, and sometimes even with videos with closed captioning. The tester should allow Debbie to describe the exercises before beginning so she knows what she is doing. The tester should always face the client so they can see the eyes, lips, and bodies. Always maintain eye contact and speak directly to the person. Demonstrate exercises and use as many visual cues as possible. Avoid working out in places that have loud background noises. Always use normal speech and pronunciation, and have visual reinforcement for motivation when needed. In conclusion, age-related hearing loss is common, and individuals are not alone when experiencing presbycusis. Exercise can help delay the progression of presbycusis, and currently there is no specific cure for this disease. So those aged 60 years and older should be encouraged to engage in physical activity whenever and wherever. And here are my references for this project. Thank you for watching.